Do you or your partner suffer from erectile dysfunction? Is erectile dysfunction affecting your sex life? According to statistics, ED affects millions of men globally, yet is often surrounded with misinformation and stigma. Erectile dysfunction, in other words, ED, has an impact on our emotions, our psychology, and our relational problem. Welcome back. Today, our guest speaker today is a senior nursing officer, and then, as I said earlier, he had 12 years of experience. Wow, 12 years of experience in the medical and then the nursing field. Please, viewers, join me in welcoming Mr. Isaiah Nkwanza. Hi, I see. Good evening.
Good evening.
You're welcome.
Please,
how are you?
I'm good. Are you?
I'm good. I'm pretty well. I recently came across a CV that says that if you take age range between men from 40 to 45 years, about 25% would suffer from erectile dysfunction. This is so serious. So, first of all, I would want to know, what is erectile dysfunction? Is it different from impotency, please?
Thank you, I see. Erectile dysfunction is an inability to achieve or maintain a satisfactory sexual performance.
Okay.
Yeah, so it means that if someone is not able to achieve a satisfactory sexual performance, then it means that person, we are saying that it's erectile dysfunction.
Okay.
And impotence is part of erectile dysfunctions.
Okay.
Yes, impotence is part of it. But initially, we used to call it impotence. But currently, it's no longer called impotence because of stigmatization that you said.
Okay,
yeah.
okay. So you are saying that today, because of the stigmatization
and those,
because of that, now we modify it to call it. The better way is erectile dysfunction than impotency. How long? Is erectile dysfunction mostly permanent, or is it irreversible? Can it be that somebody have erectile dysfunction for a year or 5 months and it can be reversed or something else?
Yeah, there are causes.
Okay.
So depending on the cause, it can be reversed.
Okay.
If the cause that caused that problem is being solved.
Okay. Okay.
So if you're able to solve that problem, it means that the erectile dysfunction will also resolve.
Okay. So what are some of the causes? You said there are causes of erectile dysfunction.
Yeah, so the causes include medical conditions.
Okay.
Yeah, medical conditions like hypertension.
Okay.
Like diabetes. Most of the times when you have those conditions, you may have they place you on some drugs that you have to be taking. Okay. So those drugs usually reduces your
ability to perform. Okay.
Yeah, so the moment those things comes in, it means that you will not be able to perform well.
Okay.
Okay. So that is one of them.
Okay.
And then two, we are talking about some drug abuse.
Okay.
Yeah, some drug abuse. Currently, the men and then those young guys, they have been taking aphrodisiacs for sex.
Okay.
Because they want to at least
satisfy
the ladies.
Okay.
So they've been taking those drugs. So the moment they stop taking it, it means the day they will not take it,
they are not able to
perform very well.
Okay.
That is another situation.
Okay.
And then we have age.
Age too.
Okay. The more you grow, the more your sexual enhancement reduces.
Your sexual drive reduces.
Okay. Yeah, so that is another.
So why will aging reduces your sexual drive?
Yeah, usually we have certain hormones in us.
Okay.
Every man produces some hormones that helps the person to at least have psychologically,
okay.
Psychologically, it boosts the immune system and then also help the circulation to separate very well.
Blood flow
very well and everything. So the moment you are growing, that hormones reduces.
Okay.
As you are growing, the hormones also reduces.
Okay.
So as they are producing the hormones, as they are growing, also reduces. When it reduces, it also reduces every aspect of your cells.
Okay.
So including your sex
drive too.
Sexual drive also.
Okay.
So that is most of the problems.
Okay. So is there any can diet to, like, let's say you are not eating well?
Yeah. So diet is also part of it.
Okay.
Diet is also part of it. Normally, especially those of us who eat in the night too much, is one of them. And then those of us who don't balance our diet, it's also part of it.
If food is bad, I think stress too can also be one factor.
Yeah, stress is
if you are not emotionally, mentally stable, I think
if you're not mentally sound,
you cannot perform. It can affect. So, what are some of the warning signs? As a man, how will I know that I have reduced sexual drive, or there's a probability that I would have erectile dysfunction?
Yeah. The moment you realize that your erection is not you are not erecting very well.
Okay.
It could be one of the
it could be one of the causes. Okay.
Or symptoms.
One of the symptoms. Yes. Okay, that's fine.
It's one of the symptoms or signs.
So one sign is that when you are not able to erect or not to maintain your erection is one of them.
That is one of them.
Okay.
2, if you are not able to erect at all. Yes, it's also one of them. And when you ejaculate very fast.
Okay.
Yes.
Okay. I read somewhere, and then I realized that people can naturally have during sex they can do other exercise like Kegel exercise, putting your mind off so that you may not release faster.
Yes.
Is that bad?
It is not advisable.
Oh wow.
It is not advisable. Yeah. So the reason why it's not advisable is that I said that the more you have sex, the more you lose a lot of energy. So that means in a natural sense, you're kind of causing havoc to your system because you're weakening your immune system very fast. You're weakening your body.
You're weakening your body. So that means that men, you shouldn't impress anybody. Don't impress any lady. Try to take any other things to kind of enhance your sexual drive. You are kind of you're killing yourself slowly. Right. Okay. So what are some of the treatment options for erectile dysfunction?
Yeah, so some of them, if it's stress that we mentioned, then you may need a psychologist. Your sexual drive, increase your sexual drive.
Okay.
Then also, you may need some drugs that will also help boost your sexual drives.
Okay. So drugs like?
Yeah, so the drugs include
we have
sildenafil.
Okay. Sildenafil or Viagra.
Yes, Viagra is there.
Okay.
We also have a penile injection.
Penile injection.
Yes, that we do. You can use those one also. And then, as I said, the cancer therapy is there. Lifestyle changing is there also.
Modification.
Yeah.
So that drug, the drug Viagra, it was initially not for sex enhancement or for impotency or erectile dysfunction. It was meant for blood pressure. It was blood pressure medication.
Yes.
Now a lot of people are abusing it, and they're using it for sex.
Yes. We were having some drugs that reduces your sexual drive.
Okay.
That the one you have the BP, some drugs reduce your sexual. So the moment you see that the drugs you're taking is reducing, then they give you Viagra.
Okay.
To at least enhance your sexual performance a bit.
Okay.
Yeah. So currently the young men, those who don't have BPs and those because they want to impress.
Okay.
They decide to take that
that drug.
The Viagra, no.
Okay.
But it wasn't made, as you said, it wasn't made for that.
Okay. So but there's still something I don't get. I see. When there is erectile dysfunction, what happens? Is it that there is reduced blood flow to the penis that is causing erectile dysfunction, or what?
Yeah, so
the penis has blood vessels. It comprises of that.
That's good.
So when it's not able to erect, that means that there's something wrong. Yes. Maybe there's a block. So let's look at something like I was thinking something like hypertension. So when there's insufficiency of blood in the heart muscles, that causes hypertension. Unlike erectile dysfunction, I think when there's something like there's inadequate blood flow to the penis, that might cause erectile dysfunction.
So we are saying that when the blood flow, when there's a restriction of blood flow to the penis, that is causes erectile dysfunctions. When there's a restriction of, and just as you said, the blood pressure could be one of them. Usually the blood pressure, when you have the blood pressure, it leads to a lot of conditions.
Other related conditions.
So it could be one of them.
All right. What are some of the natural ways men can do to help them exempt them from erectile dysfunction?
Yes, as I mentioned, the lifestyle is one of them. Lifestyle changes. If you are a person who been taking aphrodisiacs, you need to stop taking them. Then you need to do much exercise to reduce weight.
Exercise like any exercise, walking, dancing, Kegel exercises is also
yoga exercise. All type of exercise that can reduce your weight. It's also good for that.
That means people who are obese, men who are obese, they also are at higher risk of
when you're obese, you can also get that erectile dysfunction. Because the moment you become obese, the blood, the fat.
The fat can kind of block the veins, the vessels that carry blood to the penis.
So you might not be able to perform well.
So that leads to erectile dysfunction.
Then you have to, as I said earlier, you have to reduce your stress. The stress.
You see, I see. There's a problem I don't understand here. You see, nowadays the world is changing. When there's a lot of stress everywhere at the workplace, there are stresses, home stresses. How can we reduce this stress? Or sometimes you are a woman or you are a man. Your wife alone is a stressor to your life. How then do you maintain erection?
Now, in these situations, especially if your woman is stressing you a lot, so if your woman is stressing you a lot, then that one, there's a big problem. So the advice out there is that the ladies should reduce the stress that they give to the men. They shouldn't worry the men much.
So hi ladies, my IC are saying that ladies, if a lady you're watching me and then
want to perform well,
and you really want your husband to perform very well, please make sure that the diet your husband eats, you are the people who mostly cook in the house, so make sure that you cook very well for your husband. Make sure that the diet that your husband eats contain of protein, vegetables, carbohydrates, and whole grains, and a lot. Give your husband, let your husband eat well. Apart from that, reduce the stress you give to your husband. When your husband is in stress, very confused, he cannot perform well. So for your husband to get that 3 points, make sure that you do all this for your husband.
That's good. And also, reducing stress, you have a yoga exercise. Even sometimes sleeping exercise and breathing exercise.
Oh wow! Breathing exercise, is it during sex or what?
No, you're reducing stress. You need to have a period to do exercise. There's a program called PFA. PFA, psychological first aid.
Oh wow!
A psychological first aid. Well, the psychological first aid tells us that the moment you have a stress, the first thing you should do is that sit down, take some few water, then relax very well and start breathe in and breathe out. Breathe in, breathe out until 15 to 30 minutes. When doing that, you reduce a lot of stress in you. So your workplace, you may have a stress. When you come home, sit down, do breathing, breathe out, breathing, breathe out, breathing, breathe out. You'll be reducing your, and then yoga exercise. Most of you knows what is called yoga exercise.
Yes.
So you use yoga exercise. It's also very good, and you can also use some certain drugs. Like ginseng. Yeah, ginseng is very good for sexual enhancement.
Ginseng.
It's a herbal drug.
It's a herbal drug.
A herbal drug.
Okay.
Extract from.
But in Ghana here, Africa, we have a lot of herbs for that. Can you mention any of them that can help?
Yeah, so the one that is well approved is the ginseng that I mentioned.
Oh, okay. So is it in Ghana here?
Yeah, we get ginseng in Ghana here.
Oh, okay.
And I said that
it doesn't have any side effects.
Ginseng doesn't have any side effect if only you use it well.
Oh, okay.
If only you use it well.
Okay, then that's fine.
Some of them, they abuse it.
Okay.
But if you only use it well, it doesn't have any side effect because it's a herbal extract.
All right.
And then you have also some drugs that are also very good for that.
Okay.
20 and those drugs that they've mentioned, they are very good, but the way you use it,
so the overuse of it
also causes a lot of problems.
All right.
So
I think
before you take it, first of all, have to go to hospital, see your physician first.
Okay.
Let them advise you before you take it.
To take it. All right. Thank you so much, IC. Thank you so much for taking us through all this education. I want to say thank you.
Welcome.
Yeah, thank you so much. Hello, viewers. We want to end here because of our time. So I want to encourage all of you, especially ladies. We have heard from our guest speaker today that most of the erectile dysfunction that comes out is either coming from any other health-related condition like hypertension, diabetes. So men, make sure that you take good care of yourself. If you have any condition like hypertension, diabetes, make sure that you control them. And stress too is number one. So don't let anybody stress you from your house, from the workplace, and the rest. Thank you so much for staying tuned. If you like this video, please don't forget to like, share, and then again press the notification bell so that I can stay alerted whenever there is a new video. Thank you so much. I really love you so much. Bye.